want to get back to a sentence you've said. I've heard you tweet it many times. Nobody's safe until everybody's safe. It seems to me that individually, people are thinking of vaccines as sort of bulletproof vests, and nationally, people are using, and you use the term vaccine nationalism, as if vaccines can protect their countries. How are you doing with messaging and getting across this notion that nobody's safe until everybody's safe?
Well, it's very challenging because part of the problem right now, and people always ask me in the developing world, do you have vaccine hesitancy? Actually, we tend to have more in developed countries because developed countries don't, they're not familiar with the diseases. They don't see people dying, whereas in developing countries they do. Normal vaccine preventable diseases. And so what we tend to see is that situation. Now, in this case, it's been quite different because it's been very politicized, and there's been a lot of misinformation that has occurred as a result of the politicization that has affected, the science and the reporting of science, and that's a big problem because it's one world now in terms of social media. So if misinformation occurs, it spreads around the world literally at the speed of light, and so that problem is there. We tend to have good systems to get people to understand why vaccines are needed into developing countries, but we are having to deal with this, infodemic of misinformation that exists, and that is really problematic.